got a function to do with how the brain functions, as well as these hormones that we are talking about, and regulating them, and also producing hormones that will in turn stimulate other organs in the body to produce other hormones. So that's the first gland that we have in the body. And then the next one, just below it, below the hypothalamus, we have a gland called the pituitary gland. This gland is also a hormone in the brain, or is a gland in the brain that produces hormones such as a growth hormone and other hormones now that are responsible for sexual development. These are follicle stimulating hormone, FSH, and luteinizing hormone. These ones, they control growth at puberty, and we are able to see puberty in terms of breasts, menstrual cycle, menses starting, or what we call periods. And these hormones, follicle stimulating hormone and luteinizing hormone, act on other organs, which is the ovaries and the testes. Ovaries in the girls and the testes in the boys. Then the third gland look at is the thyroid. This thyroid gland is found in the neck. It's a very important gland in the body. It produces a hormone called thyroxine, or T4, and triiodothyronine, or T3. So these two don't bother so much about the jargon, but T4 and T3, these two hormones control metabolic processes. What happens at a cell level? How active is this cell in digesting, in doing its different function, whether it's a cell that is for respiration, whether it's a cell for digestion, how these particular hormones control those metabolic processes in the body. They also support the function of the growth hormone. Remember, growth hormone is very important, and that's the reason why a child is able to grow from a small baby who was carried in the mother's arms to a child who can walk on their own, and they keep on growing taller and taller. So the function of growth hormone can be influenced by these hormones, by the produced by this gland, the thyroid gland in the neck. The other gland is an adrenal gland. The adrenal gland produces several hormones. One of them is adrenaline. When you are scared, when you are under stress or under pressure, this gland produces adrenaline to prepare you to fight, or to flee, or to run away from that dangerous situation. And then it also produces cortisol. This is a steroid hormone, and it plays a role in metabolism as well as growth, and also the stress response of the body. When you are stressed, there are certain hormones that the body produces, and particularly cortisol is a stress hormone that the body releases. And we'll understand as we go along how it can manifest in a child, and we can understand what's going on. And another hormone that the adrenal gland, this adrenal gland is found somewhere in the abdomen, is a hormone called DHEA, or androstenedione and testosterone. These hormones are to give you male characteristics, for example, as well as they are responsible for you developing pubic hair, the acne, the oily face. When puberty sets in, you are able to understand these hormones at play. When you see a child's appearance, they develop pimples, they have a bad odor because of the influence of these hormones from the adrenal glands. And then we have glands, the ovaries in the girls or in female children. These produce female sex hormones. They are located in the pelvis or in the lower parts of the abdomen, and they produce these sex hormones, progesterone and estrogen, which are responsible for the development of the female sex organs, and also the menstrual cycle, fertility throughout life, and also breast development. When you see breasts developing, think about the influence of these hormones produced by the ovaries, that is estrogen and progesterone, being at play. The other gland in the body that we have is testes in the male, and the testes are located in the lower parts of the body, in the pelvis, and and they produce the male sex hormone testosterone. This hormone is responsible for sperm production when a boy becomes of age, and they are also responsible for growth and muscle mass. And because testosterone is produced more in males, when I say this, it means even females have got a certain amount of testosterone, except the quantity is not as much as in males. Similarly, the hormones that are produced by the ovaries, that is estrogen and progesterone, those sex hormones that are predominantly in the female, they can also be found in the male children, but in smaller quantities because of how the organs are made. So when we talk about testosterone being responsible for sperm production, for growth and muscle mass, it explains why men
Doc,
or boys. Yes, we are on the testis, number 6. You can continue the next slide, the next one. Yes. Yeah, we are on number 6. We are considering the testis right now. So testosterone, I was talking about boys or men having being more muscular than the female children. So when and they take so much pride, you know how boys, when they will be playing, show off their muscles. That's the influence of testosterone on their muscles. They have their muscle bulk is more than in females, except for those females who probably do bodybuilding and the like. So other sexual characteristics like facial hair, like the beards and body hair, are also influenced by the hormone testosterone. The other hormones that are available in the body that are produced are insulin. Insulin, we all have insulin. This one is produced by the pancreas somewhere in the abdomen, on the right side of the abdomen, and they control how the cells use the sugar that we take in our bread, in our shima, in our porridge, in the tute. How the cells will use that sugar is influenced by the activity of insulin. And if you don't have insulin, it means the cells cannot utilize the sugar. No matter how much you just waste it away in the urine, it will go away. And so one of the functions of insulin is actually acts like a growth hormone. You find that children who have got, diabetes type 1, the one that's very common in children, because they don't have insulin, they become so thin. They are wasting away despite eating a lot. It's because their cells are not able to use that sugar. So that sugar is just being wasted away in the urine. So insulin, if it is there, supports growth. And that's the reason why when you compare a child who has got diabetes type 1, that's common in children, and one who doesn't have diabetes, the one who doesn't will be a bit fatter. The one who has diabetes, they lose weight so quickly because of the absence of insulin. Then there's another hormone there called leptin and ghrelin. These two hormones are what controls you feeling hungry or be feeling full. You can't just be eating without feeling satisfied. So when you feel satisfied, it means there's a hormone that's at play, which is ghrelin, to tell you that now is enough, this is enough. And leptin, on the other hand, is a hunger hormone. If this leptin is too much in your system, it means you can eat and eat without, it's like the gauge for eating is broken down. It's not working. So it's very important to understand hormones. Sometimes children have got disorders where the child is just eating. It could be because of the influence of some of these hormones. So what really happens, what biological processes are influenced by hormones? So I explained earlier on that most of the time we understand hormones from the perspective of sexual or reproductive system or sexual hormones. So in the sexual reproductive system, we have two processes, adrenarche and gonadic. Now, adrenarche is just the body's response to hormones from the adrenal gland. Remember those hormones that we have talked about, DHEA, androstenedione, and testosterone. This rise in the adrenal hormones starts approximately when a child is about 6 to 8 years of age, and it continues up to about the 30s. It continues rising until it peaks. And visibly, as a result of adrenarche or the influence of these hormones from the adrenal glands, you can see an oily skin. The skin, when a child reaches this age, their skin, which was smooth and okay, starts becoming very oily. They start developing pimples or acne. And also you discover skeletal maturation. It becomes like what we call a growth spurt. There's a time when children grow rapidly. The skeletal maturation, they grow taller at a rapid rate, and also pubic hair starts growing. And also they start noticing that this child has a characteristic body smell or odor. And then gonadic follows after adrenarche. It's a progressive process. So from one biological process to the next. And the difference between the two processes is about 1 to 2 years. So you will start with the pimples, the acne, and the oily face, and the body odor. Later, after 1 to 2 years, after that process has started, now there's a reactivation of the hypothalamus. You know how the hypothalamus we talked about in the brain, it produces hormones that will act on the next organ, which is the pituitary, also in the brain. And then the hormones that the pituitary produces will act on the sexual reproductive system, that is the ovaries and the testes, in the male, in the females and the males respectively. So producing those hormones, testosterone and estradiol. Testosterone in the males mostly, and estradiol from the in females or from the ovaries. Of course, like I mentioned, both sexes have got all these hormones, except the one is more pronounced in the others because of how we have been created, whether we are male or female. So the estradiol or estrogen is to the development of the breast in girls, and the uterus and the ovaries, they start developing as a result of this gonadic. So it's a simulation of the sexual reproductive organs, the ovaries and the testes, pretty much. And the testosterone causes development of the penis, pubic hair, and the testes in male. So the penis increases in length and size. There's pubic hair starts to develop, and also the testis itself, the volume increases as this gonadic sets in. So what we can go to the next, the hormonal imbalances in children that we can see as a result of any derangement of this system at play that we have talked about. We can go to the next slide. So most hormonal imbalances in children manifest as abnormal growth or sexual development. Remember what I said at the beginning, that in children we look most hormones participate in their growth and in their development, especially the sexual development. So when there is an imbalance in hormones, you see abnormalities of growth or abnormalities of sexual development. Either the sexual development will be too early or it will be delayed. For example, like I mentioned, the hypothalamus produces hormones that stimulate the pituitary gland to produce hormones that will stimulate the ovaries or the testes. Now, if this axis occurs earlier than 8 to 9 years, in girls' maturity, the process that those two biological processes, adrenarche and gonadic, they start at the age of 8 to 9 years. This sexual maturation will start at that time. So if it starts earlier, for example, a child starts having the development of breasts and even pubic hair and menses, for example, at the age of 6 and 7, we call it precocious puberty. It means that development has started too early in that girl. And similarly, in boys mature later than girls. So when these hormones are deranged in the body, you find that puberty occurs earlier than the 9 or 10 years which you expect under normal. And it's also safe to understand that puberty occurs 18 to 24 months earlier in females than males. So there's always that lag. Girls mature faster than boys. And then on the other hand, if this pituitary hypothalamus gonadal starts late, you find that there's puberty is delayed, the menses are delayed. You have this girl who is 13 years, but the chest is flat, there is no breast. The breasts are like for that of a babe. And on the other hand, in a boy, you find the testes are not enlarging, and the volume that you expect when puberty sets in is 4, you know what they say, 4 mils or 4 cc's. That's the size of the testis that you expect in a child who has started developing sexually. So delayed puberty is also an abnormality of as a result of hormonal imbalance in children that you can see. So if you see 14, a boy who is 14, there's no testicular enlargement, start getting worried that this child could have delayed puberty. Or if there's a lag between, gonadic and adrenic that we were talking about, the effect of the adrenal glands and then the effect of the testis or the ovary in terms of sexual development. If there is a lag of more than 4 years in between the two processes, remember we said the difference between the two biological processes is about 1 to 2 years. But if it takes more than 4 years to progress from one level to the next, that is delayed puberty in that child as a result of the hormones not balancing well. So what other aspect, we can go to the next slide. What other aspect can we consider as we try to understand hormones? The researchers out there are also trying to look at the effect of pubertal hormones on mental health in children. And this is what we need to understand as parents. It is said that the hormones mostly considered in many studies are estrogen and testosterone, and puberty is a period, I think we've already experienced those of us who have got teenagers. It's a period of biological maturation, but it's also associated with a lot of social, emotional, and health changes. Children become moody, they want to keep to themselves. The things that they were excited about in the past, they are not excited about those anymore. They wanted to present in church and they were outgoing, and then all of a sudden a child withdraws. Most it could be because of the same hormones at play. So social things, dynamics change also as a result of pubertal hormones that we have just discussed. And also studies show that it may be the onset of many mental health problems. In fact, they say that half of all the mental disorders start before 18 years of age. And before 18 years of age, that's a time of transitioning from being a girl to an adult, from me being a boy to a man. And so that's the age of hormones and the time when they really peak in the system. And the studies have shown that you find most mental conditions will peak even during that time, actually peaking around 14 years, which is around the time for puberty to really be serious and at its peak. So most mental challenges are common. Now we can go to the next. In children who mature earlier than their peers, those children who develop sexual characteristics faster, they start their menses faster than their colleagues. Next slide. You find that those are the children who experience most the mental challenge, because these hormones have an effect on the developing brain, so affecting their emotional, their cognitive, or their thinking systems in the brain. So this is because high levels of pubertal hormones, there are receptors in the limbic brain regions. The brain region called the limbic system is the part of the brain that is involved in processing and regulating emotions, how we feel, anger, aggressiveness, depression, anxiety. All those emotions are set in the limbic brain system. And you find that this part of the brain has got a lot of receptors for pubertal hormones, such that when those hormones start circulating, those receptors become very active. So there are a lot of mood swings, emotional changes, emotional lability. This moment is very excited, the next moment looks moody and depressed and the like, because of those receptors being numerous on the brain at the time also when the hormones are at play. So also it has to do with the size of these limbic regions in the brain. There are some children who may have a large area of this so-called limbic system in the brain, such as the hippocampus. And it may mediate early exposure to testosterone and depressive symptoms in some adolescent males or even in females, because of just the size of that part of the brain with full of receptors for hormones. So it will receive a lot of these hormones. So these emotional changes become so many in place in children who have got a large in the brain with the limbic system. So next slide, there is something I have highlighted on the next slide that I found interesting when I was going through this presentation, that also harsher parenting following early maturation of adolescent girls poses a risk for internalizing and externalizing problems. So internalizing problems, things like depression, anxiety, because of the influence of estrogen to that girl, become more pronounced if us as parents also imagine the way we treat this transition in the child. The child is already dealing with a lot of hormones, and then also our parenting styles become harsh. No, you should be bathing. We are very harsh in the way we treat that girl, because especially girls, there are so many rules surrounding the girl, and men says don't do this. A lot of do's don'ts actually now come into play when a child starts menstruating. And if as a parent you are harsh, these internalizing or emotions within the child, depression, anxiety, become even more pronounced and worse if we don't handle that transition and that period well, because they are also handling a lot of changes. Now I'm different from my friends. How is it going to be? How will they accept me? How is it going to be? And externalizing problems. You find now this is the time, if us as parents we are harsh, substance abuse sets in. They tend to break even the rules more. The harsher you are, it's like the more they break even the rules that you are trying to make in the house or in the school, for example. Aggression as a result or as the influence of testosterone, especially in boys. You see that there are a lot of riots and hooliganism and rule breaking and substance abuse, mostly in boys' schools or in just the boy children than in girls. Again, this can be worsened by harsh parenting. So I thought to highlight so that we take note that this is somewhere we can make a change. And then also another thing that you find is that those who develop sexually rapidly than their friends are more prone to emotional problems because of they develop peer exclusion. They kind of start isolating themselves from friends. Me, I have breasts, my friends don't have breasts, like you feel funny. So if we don't take time to sit down with them to explain that these are normal changes, and they need to learn to accept themselves, that they are fearfully and wonderfully made. So they develop peer exclusion. They exclude themselves from their usual social circle because of feeling different from their friends. And also those who develop sexually earlier than their friends are more likely to associate with older peers. This is another important issue. A child develops sexual characteristics faster than their friends, so they associate with those who have similar characteristics to them, who may be older than them. And because the older, they are more experienced, they are experimenting with a lot of things. Our children, they are experimenting with boyfriends, with risky behavior. So you find early developers also a small child developing risky behavior because they are associating with children who are a bit older than them, because they are experienced, they are like them, they have developed sexually like them, and they feel like they are of age. Because remember, these hormones also influence how you think, how the brain functions. You start feeling like, I'm an adult, I can handle this, I've got this, I am old enough. So the small children associating with the bigger children, because they just develop faster, becomes a riskier problem for them if we are not there as parents to handle these children, to counsel them appropriately. Then the next section is obesity and hormones. Some hormones also influence some of the obesity that we see. Obesity means being overweight, having too much weight, and Sometimes this carries with it a lot of emotional stigmatization and trauma for the child, partly because it's just hormones at play, or because there's something that you can actually do to control either the eating habits and the activity or inactivity patterns of the child. So one of the hormones that influence obesity is cortisol, the stress hormone. Remember what we talked about, cortisol, which is released by the adrenal glands that is in the abdomen. And when they, for some children, for some people, even adults, when they have a lot of stress as a result of this, the cortisol is released, and some there's increased appetite. You know, you are stressed, the brain is moving rapidly, is working at a faster rate. So you have this increased appetite because you are using up some of the food. And also cortisol, what it does, apart from resulting in obesity and putting on fat, it results in fat building up around vital organs, and so can contribute to some of the lifestyle diseases, hypertension, heart diseases, coronary heart disease, because of this fat that's accumulating around vital organs like the heart, the kidneys, and so on. And then cortisol also can, if it is prolonged in the system for a long time, you find that the child develops what we call Cushing syndrome due to excess cortisol. And this contributes to weight gain and also slowed growth of the bones. Remember the bones. So this the child is fat, yes, but it's not, their bones are not growing, so they may not be growing in stature because of this excess cortisol. And that's the reason why we should avoid giving drugs that contain a lot of steroids or steroid containing drugs in children, because it affects the growth of the bones and it slows their growth. And it also has a tendency to cause raised blood pressure. Some of the hypertension that we see in children could be because of excessive periods of stress and release of cortisol hormone from the adrenal glands, or even external steroids. So let's be careful about steroids. The steroids, this thing of you want to bleach your skin, just bleach yourself if you want. Don't destroy a child who is still growing, because they are bones. Steroids, even if you apply as a skin cream, it will go to the whole system in the body and affect different parts of the body. So steroids, just avoid them in forms of creams, some foods that contain steroids, and including those who rear chickens. If you are putting steroids, we should avoid that, because there are children, innocent children, who are taking those things, and so it will affect their growth because of the presence of that cortisol. We can go to the next slide. So the next hormone that causes obesity in children is the thyroid hormone. When it is low, remember the thyroid gland is in the neck. So this hormone, if it's low, what we call hypothyroidism, a child can manifest with obesity. They also can have slowed growth and delayed puberty because of the lack of T3, T4, those thyroid hormones, remember, that we mentioned earlier. And then the other hormone apparently which causes obesity is this hormone called testosterone. Low levels of testosterone, it has been shown that where there are low levels of testosterone, it's linked with obesity in boys, and they are also associated with increased levels of this hormone leptin. You know, leptin is a hormone that controls hunger. How do you control hunger? We control hunger by eating. So if leptin is too high in the system, it will control it will lead to low levels of testosterone, but also result in overeating and obesity or gaining excess weight. So those are the hormones. The next hormone that we can talk about is insulin. Remember, I said insulin is a growth hormone. So there are, even when there's an excess of insulin, or when there's a tumor in the pancreas that produces excess insulin, this child will be always hungry. You know, insulin finishes fast the utilization of the food that is eaten quickly. The cells use it to store it, and so this child puts on weight because insulin is a growth hormone. The other hormones that result in obesity are androgens. Some of the hormones that are produced by the adrenal glands, you know, the DHEA that we talked about, and including conditions like polycystic ovarian syndrome. I think we've heard about this syndrome. Even children, some children can have this. And so there is excess production of these androgens. There is, remember what we talked about androgens as them that are responsible for development of hair, acne, body odor, and the like, and oily skin. So they can result in obesity. Remember, they're putting on excess weight, and also irregular periods. So we've seen, so some children who have got obesity is because of the influences of some of these hormones that we have listed here. So finally, as we wind up on this presentation, I know this may not be exhaustive, but I just thought to bring out a few things where hormones are at play in children, and we can actually visibly see something and probably do something about what we are able to see. So there are a few tips for parents to navigate the hormonal changes in our children. One of the things that we can do as parents is to have good communication. We need to openly communicate to children, especially about puberty, that these are normal changes in the body in children, to help children accept themselves, and that yes, they may look different, but it's actually part of the normal growth of them being fearfully and wonderfully made by God Himself. And also we can role model and set boundaries where necessary. They don't have to be aggressive just because that's the emotion that they are feeling. You teach them that there are consequences to every action that they do. So it helps them set boundaries, that this I can do, this I shouldn't do. We also need to help children understand the effects of puberty on their bodies and emotions. Sometimes when they are moody, we shouldn't shout at them. We should try to understand them, maybe help them openly express how they really feel about everything that's going on. Whether they are sad, they should just express it, that they feel sad, they feel depressed because they look different, they are bathing, but their pimples are not finishing, they've tried all the soap, just to help them understand that these are effects of puberty, and there's a time when it peaks and then the body normalizes, like what we call a plateau. There's a curve. There's a time when it peaks, so I think there will be a lot of changes in the body, and they need to understand that, and the emotions. And also we need to encourage good or positive behavior, aggressiveness, breaking rules, substance abuse. We can always encourage the good and positive behavior to counteract the abnormal or negative behavior that they will end up because of how they are feeling inside, how they may be angry, they may be depressed, anxious about when are these pimples going to end. We need to encourage them to develop a regular sleep schedule. Sometimes in adolescence, as a result of certain hormones, I didn't talk about this hormone. There's a hormone that is released called melatonin that supports sleep. And sometimes with the onset of adolescence or puberty, these changes that are taking place in the body, you'll find most of our children want to sleep late. It's because of how these hormones are produced. They may be produced late in the afternoon, such that sleep will only come later on. And so we need to encourage them to develop a regular sleep so that they don't get into trouble at school. They sleep late and then they have to wake up early and they are dozing in class and they are not getting as much, and it affects their school grades. So we need to have them have a regular sleep schedule, which the body kind of adapts eventually when you have a regular schedule. Help the child adopt healthy eating habits by modeling it ourselves. Let's eat healthy. That way will also help them to eat healthy, especially when these hormones also bring a lot of appetite to increase the muscle mass. So when puberty sets in, those of us who have boys, is even worse. You find that the appetite is excessive. It's like the food finishes before it even lands. Before it reaches the fridge, it's just on the shelf, it has finished. So we need to just encourage good and healthy eating habits, because sometimes they can be out of control because of this increased appetite. And also we need to keep calm during the mood swings. Sometimes we worsen things as by shouting as parents, why are you doing like this? Why are you just looking at us? Why
Sorry, dear parents. The dog could be joining shortly. It could be network.
Sorry about that. I think I must have gotten off. Which point was I on? Hello? Can anyone hear
Yes,
me?
dog. Yes, you're loud
Okay,
and
I was
clear.
on. Okay. Which point was I on?
That one which is saying
About
encourage good or positive behavior.
Okay, all right. So we need to encourage good and positive behavior as opposed to counteract any negative behavior that can come in as a result of them being frustrated with all these hormonal changes. We also need to encourage them to develop a regular sleep schedule because there are certain hormones again which get affected with whatever is happening as a result of other hormones. Other hormones also get affected. The sleep hormone, melatonin, so they tend to sleep late. So we need to help them develop a regular sleep schedule, don't miss out on class and the benefits of, and it starts affecting their learning in class or at school. We also need to help children adopt healthy eating habits by modeling it ourselves. These hormonal changes can affect the appetite, like we have said, and sometimes their appetite can be out of control. So let's model good eating habits and encourage them to eat healthy because it's good for their health. When cortisol is and stress hormones are high, they eat anyhow. We remember cortisol also contributes to fat being deposited around vital organs, resulting in conditions like heart conditions and hypertension and the like. So we need to help them model good eating habits. You also need to keep calm during mood swings. Let's not shout, let's to exacerbate the situation. Let's try to understand their feelings and also uh, give them space when they need it. But also we need to watch that it doesn't prolong, because if they constantly child wants to keep to themselves for a longer time, now it moves from being normal mood swing as a result of hormones. Probably you are dealing with a serious depressive disorder, especially if it prolongs more than 2 weeks and the child is not really coming out of this situation. So we need to give them space, yes, to ensure it doesn't prolong. We also need to help them problem solve by, asking them open-ended questions on what is going on and how they think is affecting their life and what solutions they can come up with themselves without you trying to fix everything. Parents, we are always wanting to fix things for our children all the time, but we can always help them to think through a situation so that the solution actually comes from them when they fully understand what they are up against. So yes, we should help them to navigate, but let the solution come a lot from them. Not how the mood swing disrupts their home, school, or social life, and make sure that you intervene. Or sometimes you may need a counselor, either even at school itself. You can utilize the teachers to help you navigate or help the child navigate. And then also, you need to be assertive as a parent that aggressive behavior is not acceptable. So they need to understand that there are consequences to every action that they take. So yes, they are maybe depression, or they are anxious about how these hormones are affecting their body. They have got big breasts, they are pimples, they're oily, they put powder in the morning, after 2 hours it's finished. Just, aggressive behavior is not acceptable, despite what they may be feeling. So we should make it clear that there are consequences. And lastly, we are saying that your parents need to seek professional help when necessary. If you think these hormonal issues and the emotional, cognitive, or social aspects are getting out of hand, you need extra help. Let's be parents who seek professional help when it's necessary to do so. Or if you think it could actually be a hospital condition that requires a medical attention, let's do so, because hormones, like we have said, there are so many hormones in the body, and just the way they can affect adults, they can also affect children, even if they are not sexual hormones affecting puberty and the like. They can be hormones affecting they assist him in a way, and it could actually be an indicator of a medical problem that requires you to seek professional help at the hospital, a psychologist, or wherever the child can receive help. Don't sit if you think the problem is beyond what seems to be normal in the context of what we have shared this evening. I end here and seek for questions and contributions.
Wow, wow, wow. Thank you very much, Doc. I have benefited a lot from the lesson that you have shared with us. Hey, this is good. This is extremely good. Dear parents, we have come at a time when we can interact with the presenter. We ask questions and contributions, comments. Please, it's open for questions. You can write in the chat box. We will be able to read. If you want, you can just raise your electronic hand, or you can just unmute, and then we'll be able to attend to your question, your contribution, and your comment will be highly appreciated. Doc, thank you very much once again. Allow me to invite parents. Please, this is the right time for us to interact with our presenter. The first question in our chat box says, does it mean when children, that's girls in specific, begin their menses as early as 10 years? Could it be because of depression, trauma, and stress? And is it normal? Question mark. Doc, please.
We said that puberty actually in girls, it's okay to start between 8 and 9. They can start having breasts, and within 2 years, which will be if the process technically, if it begins at 8, by 10 it's
Could be network. The doc is just joining.
Sorry, I must have fallen off again. So I was saying that 10 within normal for a child to have menses. Actually, from what we explained, that girls start sexually developing from the age of 8 or 9. So within 1 to 2 years, they'll have progressed to puberty. They can have menses at that time. So I have had children 9, 10, and many parents get worried to have a child have menses at 9 or at 10. It's still within the normal accepted. It's not precocious puberty. That is an accepted period of puberty. And also, the other thing that you can use is what is normal within that family. In certain families, they start menses at a certain age. And so you can still gauge from the female relatives of that child, the mother, the auntie, the sisters, when did they have their menses, and it should usually fall within the same period. So there is also a familial factor and also the diet. But 10 years is not too early, especially in our environment. In fact, they say in the environment where it's very hot, we tend to have children starting their menses a bit earlier than in other places. So it's still within normal and what is accepted.
Thank you. Thank you very much, Doc. Parents, we are open for discussion, please. You are free to just write in the chat box. You are free to raise your electronic hand. Yes, Sister Kaula. I've seen you have unmuted your mic. Please, you can come through.
Good evening, Doc, and good evening, Pastor Mishek. I have a question. I think we see a lot of suicidal signs or suicidal issues among teens. Suicide thoughts. Are they also part of hormonal imbalance? Are they also part of puberty? Is it that the child doesn't understand who they are anymore during puberty or during the process of puberty? That's why they have suicidal thoughts.
That's an excellent question. So remember what we mentioned about some of the effects of hormones on on the brain, the cognition, and the externalizing and the internalizing effects, so the internalizing being the depressive disorders that you see, anxiety and so on. And this is the reason why when we talk about puberty and the changes that are taking place, as parents we need to open our eyes and be alert, because some things we exacerbate them or escalate them. We shout unnecessarily and push the child to certain points because we have failed to understand the stage they are going through and also some of the circumstances that are surrounding. It could be one of the reasons could be because of the hormones. So depression is one of the common things. Remember we said mental conditions. In fact, half of all the mental conditions will start before the age of 18, which is around the time when also hormones are most at play, peaking, and they are not yet stable. So this is the time when we really need to understand what's going on in our children so that we help them to navigate. Yes, if they have misbehaved, we can shout, we can discipline, but we should also understand that sometimes a child may not take it well because of what's going on with them and their hormones. So it's a possibility because of what we have already discussed this evening. Yes, there could be other issues that could be at play, substance abuse and other issues. So let's take time. These tips are very helpful. You being calm during mood swings and trying to understand their feelings and what's going on with the child is very important. The first point I put there, good communication, role modeling, and setting boundaries can be very helpful. Sit down with the child, be patient with them, dedicate time to just listen to the child to understand what's going on. You learn a lot, and it will avoid some of these suicides that we are seeing in young people. You remember also we are living in a time when for them, even a little stress, they may not be able to handle what we were able to handle in the past. There are a lot of dynamics at play. So we need to be good parents who are balanced in the way we parent our children. Thank you.
Thank you very much, Doc. Thank you very much, Doc. There's a question in the chat box. The question goes like, how can one classify a child who behaves like a boy? Does they have more testosterone hormones, or these hormones are mainly found in boys? We had people saying, this one has male hormones, looking very masculine in appearance, but one is a girl. Please, Doc, how can you help in this question? Thank you.
Okay, thank you so much. So this is also another important question because yes, we've seen a lot of these. Some of them could be actually psychological problems of someone feeling inside them that they feel like they should be a girl instead of a boy or vice versa. And some of them could be actually because of the hormonal imbalances. So you find even their features, the external features, because there are some hormones that are more expressed than the others. So you know that you are a girl, but you behave more like if you are a girl, but you behave more like a boy because of the expression of some of these hormones. So there is truth to that one as well. There are also disorders that we call disorders of sexual differentiation, where uh, actually what we see from the outside maybe different from what is inside. Outside it looks like you have a penis and the testis, but actually inside you have an ovary and things like that. So when I had a child, some one hospital, he was raised as a boy, but actually when he became a teenager around 12 or so, he started developing breasts and hips like a girl, and it became a problem for him. So apparently he had even when we examined the what we call the genitalia or the sexual parts where that of a boy, but with some abnormalities. So you find that some of these are the patients, or these are the children who sometimes may require further investigation to really understand, or sit down with somebody, a professional, to help them navigate this issue. Because we will see many, and we are seeing a lot, especially in the Western countries, where you know,
Hello?
hey, sorry about this network thing. I was trying to explain. Hello, can you hear me?
Sorry for this network. The doc, Sister Strida Kavansa, you are also a doctor. You can come through, please. Maybe we have other mentors here who are doctors, and you are a parent. You have experienced this. Please, you can come through as we are waiting for the doctor. It will be highly appreciated. Thank you. The doctor, I've seen you joining, but there's no mic. Oh, the network is horrible a bit.
Are we
Okay,
back?
thank you. Yes, doc.
Yeah, I don't even know where I ended after I was
Equally, I
cut.
was this. Please.
Okay, so we were answering that child who behaves like a boy, right? Yes. So
Yes,
sometimes,
please.
yes, there could be hormonal issues at play. And I was trying to tell a story of how we had a child who, when he became a teenager, he was raised as a boy. The penis was short. There was one testis on one side, and he was actually passing urine like a girl, because the point where urine comes was like at the bottom. So I had a problem, and an abnormality with his reproductive organs. And so, because the hormones he was producing were more of the female that were pronounced, so he had hips, he had breasts, and it became a problem for him as he was growing. He was always in a jersey, whether it's in October, or no matter how hot, he would be in a jersey because of those breasts. So what I'm saying is that sometimes, yes, it warrants investigation for those children who may be behaving. He's a girl, but is behaving like a boy, like a tomboy. For some, especially when you see it's exaggerated, and some of these symptoms that we have talked about, the characteristics that are supposed to be male are more pronounced in this child who is supposed to be a girl. It could be hormones at play, yes, this hormonal imbalance that we're talking about. Other than puberty coming too early or too late, sometimes a boy can behave like a girl, or a girl can behave like a boy, because of this imbalance in the hormones. Some of them are just psychological conditions also, which have a role to be treated and managed by professionals in the either psychiatry or psychological arena, because these are things that we are seeing in the world out there. People just coming and waking up one day and feeling like, I think I would rather be a man, so you remove my breast, you give me a penis or something like that. And so those become psychological problems that also have a role to be managed in a specific discipline that deals with such. That's how I can answer that one.
Thank you very much, Doc. Please, in the chat box, there was a message from one of our parents who asked about a boy who plays with his manhood. And then, please, I was kicked out and I lost that message. I'm asking for Sister Charity or anyone who has that message in the chat box. Please, you can read it for the doc so that she can respond to that message. Thank you.
Pastor, the question I'm seeing here is saying, how can you handle a teenager who is just annoyed anytime without any cause, just shouting at his young siblings, being moody, just wanting to do his own things? That's the question that I've seen in the chat box as at now. Unless
There's
there was
another
another one.
one. There's another one on top, which is saying, how do I help my boy who is 13 when he just sitting the private part stands? Is getting frustrated.
Okay.
Thank you. That was the question
So
before this one. Doc, please.
those are interesting questions. So for the one who is shouting and is moody, my network is so unstable. Sorry. So the one who is moody all the time. So for that one, remember the good communication and trying to sit down with the child and trying to understand what sort of problems they have. And if you think you are still having challenges, there are other people who can help you. If you think it's beyond what you can handle as a parent, you can always seek for help from the pastors, from prayer warriors, and from psychologists or from the hospital, because it may be something more. Remember, if it is something that's prolonged, they are moody all the time and disrupting their home, their school, or social life, then it is a cause for you to worry and take an action to seek help for that child. If so, just sitting down with him does not help, and calmly having a good conversation. And then for the child who fondles their genitals and they are standing, well, that's a child also who you need to sit down with and understand what is going on with their body, because sometimes puberty comes with all sorts of changes that happen. You find maybe when the boys wake up in the morning, it is they have the penis is up, and sometimes they can be frustrated. Sometimes that's part of just how the hormones work in the boys, in a man. Early in the morning they can have that. But if it's frustrating them, it means that child also is concerned about what's happening to them, and you need to understand what's happening to them, what's causing them, what kind of things bring it out. There are some conditions, for example, people with sickle cell, of course it will be also painful, this erection that's prolonged and it's painful. Some of them with sickle cell, they have what we call priapism, where they have this erection that is prolonged and is painful and could be dangerous and could result in infertility. So try to understand what's really going on. And then sometimes some of our young people can be under the influence of many drugs that are, boosters for this sexual activity and the like. Try to understand, try to investigate what is really going on. Our children are drinking so many things, Athens and so on, which can have all sorts of effects in their bodies. So if it's frustrating the child that much, try to understand what's causing. And if it's something that you have tried to investigate, it's not something that you are able to get to the bottom of, you need to seek help for that child, so that you get the help that you need. We have urologists, we have specialists who actually deal with such kind of abnormal erections in boys or in men. So there is always help for all these. Just take time to understand and sit down with a child. And if it's something you cannot manage or handle, there are experts who can handle and help you.
Thank you very much, Doc. You have answered the question correctly. We are very, very grateful. We don't want to leave any parent behind. I can't see any hand. I can't see any message in the chat box. Now I've seen one question, and another one is popping up. Hey, Doc, in a circumstance where the erection in a child is prolonged, what interventions are available? Great presentation, thank you. The erections is so long, is prolonged for a long time. What help can you give to such a child who is a male child, of course?
Yeah, so this is where I was explaining that there's help. There are urologists who can handle this. Don't try this at home. There are certain interventions that they do to kind of decongest. You know, when there's an erection that is prolonged, an erection simply means there is a lot of blood flow that has gone there to make the penis hard and erect like that. So there's engorgement of those veins. They are full of blood, and that blood needs to be sucked out in as one of the interventions that they do. So don't try it at home because you may cause more harm than good. So take that person to the hospital so that they get the help that they need from the professionals, from the experts, in a sterile manner without causing unnecessary infections. And then the next question says, how do you help a child who is going to school and actually gets sick when she is going to school, even after changing the school? The behavior still continues. Sometimes she's truly sick, but it's becoming a habit. Now, do you think this has become psychological? It could be yes or a no. Sometimes children, yes, will react if there's any change. There's somebody who posted something about sexual defilement or sexual assault. If a child is being sexually defiled or assaulted, there's a threat somewhere. There is someone they will try to avoid, not somebody they try to come close to. They may avoid a certain place or a certain situation. Or if there is stress either in that class from that teacher and so on. So try to understand, try to ask from the teachers what's going on there. Some of us, we don't like talking to the teachers, but we can learn a lot. If it's not from the teachers, there's a friend or who just try to sit down and understand what's causing that behavior. There's always a reason other than just concluding that it's a psychological problem. It may be, but there's always a reason why bank school. I had this experience with my son when he changed schools. It was a new school, so he was having a stomach upset. He didn't want to go to school. And I just said, you know, this, you are not sick, your temperature is okay, you don't have diarrhea, you are just vomiting. So my friend, just so you try to counsel the child, just get you until that behavior ended, it stopped. But it was really serious, you know, like for a week or two, it was just like that. No, I'm not feeling, oh, my stomach is paining, I don't want to go to school. So it's that response. It may be a response to a new environment, a response to a new teacher, a response to something which has changed in the environment. There's always something, no matter how small. Sometimes you realize them, but it could be serious enough to cause a child to behave like that. So always try to understand, and unless you have talked to the teachers and everyone you are failing, then probably you need to change school or something like that. But there's always a reason. Yeah.
Doc, the last question is, Doc, is it okay for a child to urinate in bed at the age of 15 years?
So this one, if a child is still urinating at this age, this is a very cause to or for worry. There are so many reasons why a child would bedwet, would urinate in bed. Again, I have a lot of experiences with some of these things. There's a child who was urinating in bed all of a sudden who had not been urinating, for example. It means there was a stressful situation around that child. One was defiled, and then another one actually had developed sugar, you know, diabetes. This thing of you are frequently going to the toilet to pass urine. So if you are in deep sleep, then you will not wake up. But it's because of that condition, the sugar, it's demanding that you wee every now and then. So you end up urinating on the bed. Others is because of just a pure condition called nocturnal enuresis, and nocturnal enuresis at this age is not normal. It requires you to seek help and help the child to navigate this, because by this age, most children, even by 3, 4, 5, they will have urinated, such that by the time a child is 9, they should not be urinating on the bed. It should be something of the past. So to always try to understand, there could be some stressful situation that's provoking that, sexual defilement, the sugar disease, or even a urinary tract infection, just something that's causing that child. But other than those, there may be just nocturnal enuresis, which is a condition that requires being managed, because you don't expect a child this age to urinate in the bed.
Thank you very much, Doc. much appreciated. I can't see any question which we have not attended to, and I can't see any hand from any parent who has a question. Maybe could there be any question that I didn't read in the chat box, or anyone who raised the hand but we are concentrating on the messages? Please, this is the few minutes we have remained with, so that we can give the conclusion remarks to the doc, and see each other next week. Could there be any question, any comment, any contribution before we call it as a day or a night? I'm checking, I can't see any hand. I can't see any message. Allow me to say, Doc, thank you so very much for coming through, sparing your time, speaking to us, and we have benefited a lot. Parents, I also want to appreciate you for joining and being very active. This makes the group indeed special. Those who have just joined for the first time, you are welcome to Every Child is Special. This is a group where parents meet and discuss issues that concerning or issues based on how to raise our children. The person who invited you can share with you the link so that you can also be part of the group called Every Child is Special. Doc, we are very grateful and forever grateful. May God richly bless you and bless your family. We'll meet again, as we are going to invite you soon to speak to us as parents. Please, Doc, you can give your closing remarks, and then we'll ask. I saw my mother here, Scanner, on the call. Please, Mama Sarah Scanner, you are going to close for us in prayer. Yes, Mama Sarah Scanner, you close for us in prayer. Please, Doc, you can give us your closing remarks.
Thank you so much, Uncle Pastor Mishek, and thank you, parents, for joining in. It was my pleasure to give this presentation. Let's understand that hormones are real chemicals that are at work in the bodies of not only children, but also us adults. And so, based on the fact that we have walked the road where our children are passing through, we need to give them a listening and an understanding ear as they navigate through these changes that may be taking place in their bodies as a result of the effect of these hormones. So when you need help, there's always somebody who can help you when you find that it's beyond your control. So let's always look out, let's help our children and understand that hormones are normal part of life. Even the mood swings are normal part of life. It's not a disease, but if it gets out of hand, let's
Hello?
Yes, Mom Sikana,
Hello,
you
can
can.
hear you.
Okay, shall we pray? Our God and our Father who art in heaven, we just want to thank you for this evening, for the lesson which we have got from our doctor. Thank you for giving her that wisdom, Jehovah. Continue to bless her and continue to bless this ministry for Pastor Makongo. May all the parents in this group, Father, be blessed as they take care of their families. Thank you, Father. We have learned a lot, and may we share it with our friends. Continue to bless us all and give us a blessed week. For we pray and ask all this in Jesus' mighty name, with thanksgiving in our hearts. Amen.
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 Amen.